So this is the newborn assessment. You're going to start in a well-lit area. Make sure it's free of drafts. Maybe you want the parents nearby or the baby sitting in the parent's lap. First, you will do the least invasive techniques first, and the most invasive at the end, which would be the tonsils, the uvula, and the ears. So before you do like the general assessment, you'll find out the gestational age, which you can determine that by using the last menstrual period or the sonogram. And then you'll do the APGAR score. It has 5 categories: pulse, reflex, appearance, respiration, and muscle tone. Each one is scored from 0 to 2 in the 5 areas for a total of 10 points, and you perform it at 1 minute and 5 minutes. And 7 to 10 is the good average of score. So first we'll start with assessing the reflexes. You're going to start with the rooting reflex, where you stroke the baby's cheek and they shall suck your finger. Then you're going to do the Moro reflex, is where you're going to startle the baby. You're going to hold the baby with one hand under their back and then one supporting their head, and you'll almost kind of drop them to like startle them to see their reflex go. Or you can make a noise. Then you'll do the gallant, which is where they're going to be laying down like this, and you'll stroke one side and their body should turn or reflex towards where you're stroking their back. Then you'll do the sucking reflex with a gloved finger and put it in their mouth to feel them suck. The tonic reflex is where they'll be laying down and you'll turn their head to one side and their arms and legs should extend on the side that you're turning their head towards. Then you'll do the palmar grip, a palmar grasp, where you put your finger inside their hand and they should grip your finger. Next is the stepping reflex, where you'll hold the baby up and just gently place their feet on the surface, and they should almost mimic a stepping or like they're stepping. And then last will be the Babinski, which is where you're going to stroke from their heel all the way up to their the top of their foot, and they should reflex and spread their toes out. So throughout the assessment, you'll want to notice the interactions between mom and baby. And for vital signs, we'll start with vital signs. You can do an axillary temperature on the babies. Next, you're going to do an apical pulse and respiratory rate, which you will assess for 1 full minute. And for the apical pulse, you'll use the PMI, the point of maximal impulse. You won't typically assess their blood pressure, but if you do, you'll assess it in all 4 extremities. And next we will do measurements. We'll measure the baby's weight and height. Height, typically when you're doing their weight, they'll be laying down and you can draw a line, and then assess. You'll use a measurement and measure it there. You'll also take a tape measure and measure around the circumference of their chest and the circumference of their head. When you're using the height and weight, you're going to want to use the corrected age of the baby. Next is nutrition. You'll want to ask the mom, are they breastfeeding? Are they bottle feeding? How many wet diapers or bowel movements do they have? Typically, it's going to be 4 to 6 times a day. You'll want to ask if the bowel movements are soft and not watery. And you can assess the nutrition by looking at their hair, skin, and nails. Next, we're going to look at the skin. We'll assess the skin for color, any, there's the Mongolian spots, what else? There is the spider nevis and the macular stains, which are all normal in a baby and with time will correct themselves. You'll want to assess the posterior fontanelle and the anterior fontanelle. The posterior fontanelle will be present until about 3 months, and the anterior will be about 9 to 18 months. You'll assess the eyes, looking for pupils that are round, equal, reactive to light and accommodation. Make sure they're symmetrical. Also, their reaction to light, you know, they usually don't like light, so if you shine a light in their eye, they'll tend to close their eyes and make sure that they're reacting to the light. For the ears, this is when they start to not like it, so you want to save this till the end. You will use an otoscope to assess their ears. You can assess it by lifting up the pinna up and back and putting an otoscope in and looking at the tympanic membranes. And also typically at the hospital, they will do a hearing screening on the baby to assess their hearing. For the nose, mouth, and throat, this is also a part they don't like. So you will look for, at the nose, for symmetry and patency of each nostril. The way you can test the patency is by getting like a cold glass slide, putting it under their nose, and you'll see it fog to see, you know, if their nostrils are patent. A good time to look at the uvula is if they're crying. So you don't, you know, anytime during the assessment, if they start to cry, you can look in the back of the throat and assess that. Then we're going to assess the lungs and the thorax. You'll watch their breathing. They're abdominal breathers, and they breathe fast, rapidly. So just make sure that it's symmetrical when it's rising and falling. You know, they're not in any respiratory distress. Next, we're going to assess the heart. You're going to listen for the heart at the PMI and listen for S1 and S2 sounds. When you assess the breasts, you're going to assess the areola, that it's full and that they have formed nipples. And sometimes they can leak. That's just from extra estrogen, so you want to tell the mother that that's normal and it will correct itself with time. When you do the abdomen, the same way you do an abdominal assessment on an adult, you're going to auscultate, percuss, and then palpate. Same way in all 4 quadrants when you listen. And you can listen with the bell. It's a smaller side, and you'll listen, auscultate, you'll percuss for their organs, and then palpate at the end for any tenderness. There are 2 maneuvers that you can do to assess for their musculoskeletal system. The first is the Ortolanians maneuver. It's where you're going to take their legs while they're laying down. While they're supine, you will flex their hips, and you will apply, flex them 90 degrees and apply pressure. And when you're doing this, you're assessing if there's any clicking or clunking, which that's not normal. So then another one is the Barlow maneuver. You'll hold that 90-degree flexion, and you'll press down, and the femur should stay in the acetabulum. And then you can assess the genitals. For girls, the clitoris, it might be enlarged. You want to make sure that there's no foul odor or smells coming from them. Make sure that they're being cleaned properly. Sometimes, typically, for girls, there can be like little blood in the diaper, which that's just from extra estrogen during pregnancy, and inform the parents that that's normal. And when you're assessing the boys, you know, if they had a circumcision or they're uncircumcised, gently pull the foreskin, not just to examine it, and also again make sure that they're clean and free from odor. And you'll want to assess the urethral meatus if it's positioned in the center, it's not above or below. And then, not typically, but sometimes you'll assess the rectum if there is a reason to. And that concludes the newborn assessment.